Premier Stefanson, thank you for joining us.
Great to be here with you, Ian.
You were sick a little while ago. How are you feeling now?
Feeling great, thanks. Yeah, all rejuvenated and everything after the holidays, so feeling great.
In these divided times, being Premier can be a tough job. How are you handling it? What's it been like for you?
You know what? Look, there's been lots of challenges, there's no question, and in this role I knew getting into this that there would be some difficult times ahead, there's no question, but I'm just so incredibly proud of the team, of our team, and how many things that we've been able to accomplish in a very short period of time, and again, just kind of taking that collaborative approach, working with other levels of government. It's just been an amazing experience.
Yeah. What's been some of the toughest criticism you've received?
Well, I think it's. I think a lot of people maybe don't know who I am and what I'm achieving here in Manitoba. And I think, from a communication standpoint, we've got to work towards getting those messages out and all the things that we have achieved over this last year, which has been really exciting. I think a lot of people don't know about them though, and so we'll continue to work towards getting those messages out. And I think once people see who I am, I genuinely love this province. I genuinely love the people who are here, and I want to do what's in their best interest. And that's just what I'm all about.
So how do you fix that then? To have more awareness about yourself and what your party has done?
I think it's just getting out there. I mean, I've been out there quite a bit, I think, over the last year. I think, I'm sure you're probably getting sick of me too, Ian. But I've been out there quite a bit. And, I think it's just, again, doing more of that, getting out and visiting with Manitobans, working with them, listening to them, hearing what they want to achieve in the next little while. Of course, we couldn't do that during the pandemic, and so now it gives us that opportunity to get out there and visit with more Manitobans.
In the past year, what's been your biggest accomplishment?
I would say that it's really focusing on turning our economy around. Of course, what we want to do, and looking after Manitobans as well, I would say, on the affordability side, making sure that we're getting money out to Manitobans that are really struggling and trying to make ends meet. Obviously making more investments in healthcare, things like human resources as well. We announced our $200 million there towards 2,000 more people working within the healthcare field. Also tackling surgical and diagnostic backlogs. I mean, this is what Manitobans have been telling us. Also making sure that our streets are safe. And we've been, I know Minister Gertson's been working hard on that. We've also been working hard on the mental health addiction side. We'll have lots more coming in the short while when it comes to homelessness. We take that very seriously, and a very balanced approach there, I think, that we're taking to it. So I'm proud of our team and what we've been able to accomplish.
What's been your most challenging moment?
I would say that it's challenging when people maybe aren't aware of some of the things that we have done, and when we get out, and when I get out in front of people and say, okay, these are the things that we have done, these are the steps that we have taken, and they start to hear some of the steps that we've taken in various areas, whether it's healthcare or it's mental health addictions, whether it's poverty, whether it's making sure our streets are safe. All of those things, we make these announcements, right? But we need to get out in the communities more and let people know what we're doing. And of course, I think that's been a challenge, but certainly a challenge that we've started to overcome as well.
When you look back at the last year, can you tell us one thing you regret?
I would say that, have we always gotten it right? Maybe not, right? And I don't think anyone's going to get everything right all the time. I mean, I look to, we know that we provided some money for shelters, for food banks. We recognized there was more work to be done, so we turned that around and made sure over Christmas that we were looking after the most vulnerable people in our communities. And so I think it's recognizing where there needs to be more work, where maybe we had more work to do, but recognizing that and making sure that we learn from that and we move forward and make sure that we're getting the help to those who really need it.
Are you saying you rectified that over the holidays with sort of an announcement?
Yeah,
I think that
we did. Yeah, with Manitoba Harvest, you'll recall we partnered with them and getting more monies out to food banks across the province. They have partners right across the province, so it made sense to partner with them on that. So we did that. Things like Samaritan House in Brandon, the shelter there, more money for them as well, and just looking at ways to help the most vulnerable, I think, in our communities is really something that we were able to do over the holidays as well.
The province has started a tax review in the hopes of making our province more competitive. Can Manitobans expect new tax relief this year?
Yeah, I think I'm not going to predispose what will come out of that, but I do know they're working very hard, not just on the taxation side, but making Manitoba competitive across the board. So if you're thinking about things like reducing red tape, making sure that businesses are able that we're creating the environment here in Manitoba that's conducive for them to grow their businesses here, rather than looking at Saskatchewan or other provinces or even the United States. Very important. If we grow our economy here, we know that that's how we're going to increase, revenues to government to be able to pay for things like healthcare, better social services. Also looking at making sure that we've got money there for mental health addictions, which we know has been a significant challenge as well.
Business taxes, personal taxes, is one of them a greater concern for you than the
I
other?
think it's, when we look at it, what is competitive, and what is the, and I'll look to our advisors to come up with what they believe, and we'll take that under advisement and take it very seriously, because these are the experts out there. These are the people that are out there in our community, in our communities, not just business community, but arts community, and making sure that we're competitive across the board. When we're looking to attract investment to Manitoba, not everyone's just looking at taxation. They're looking at, do they have a vibrant arts community? Do they have things for us to be able to go to? And I think, you and I were at Travel Manitoba yesterday or 2 days ago, whenever that announcement was. And that was exciting. I mean, you see, and what Manitoba is all about. Manitoba's heart is calling. It's a very exciting time for the future. And I think when you're looking at creating a competitive environment here in Manitoba, you have to look beyond just taxation. But that's a very important part. Obviously, affordability for Manitobans, and looking at relief for Manitobans during very difficult times as they're facing right now. Again, nothing unique to Manitoba, but we want to make sure we're competitive with other jurisdictions across our country.
Could we see something similar to the affordability package of the summer, something to deal with inflation, like a financial package of some kind? Yeah,
I would say stay tuned on that one. We will have more coming on that front. I think it's very important that Manitobans know we have taken steps already, our $87 million package. When we look at Manitoba Hydro as well, ensuring that that's a viable Crown corporation, and making sure, and they've come out and said that they can, as a result of the actions that we took to keep more money at Manitoba Hydro, that has resulted in us being able to keep rates very low and stable for Manitobans, so they know what they can predict like decades down the road. So I think that has been very, very positive for Manitobans as well.
When's the last time you went for a walk in downtown Winnipeg?
I was there, I was at the hockey game a couple of nights ago. It was that Monday night between the U of M and the U25 Ukraine team. Which was really exciting, by the way. The Ukraine team got the first goal, and the whole crowd was just unbelievable.
Did you walk the streets?
Part of it, well, it wasn't walking the streets, I would say. Of course, I was away on some holidays over, so really being in our downtown area probably would have been in the fall, I guess. Yeah.
What did you see from I guess you mentioned in the fall.
Yeah.
What do you see when you go downtown?
Well, I certainly know that there's a lot of challenges that we're facing with respect to homelessness, mental health, addictions. That's why we're taking, and I want to be able to help those individuals, and we are taking steps and measures to ensure that we're taking, an approach to a recovery approach to make sure that we get people off their mental health and addictions. But recognizing that this is a challenge. It's nothing unique to Manitoba. I think you're seeing it happen across the country as well. But I want to be able to help those individuals. I don't want to see them struggling.
So what more can we do? Sorry.
Well, I think what more we are going to do is we're going to look at ways to help them recover from their mental health addiction. So I think what you will see is more supports going towards mental health addictions, homelessness, moving forward. So things, like housing, things like, poverty reduction, things to help those individuals, like, looking at more investments in the rapid access to addictions medicine clinics that have been very successful at helping people, in that short term. And also, you'll recall that we announced in the throne speech as well, 1,000 more spaces for recovery spaces for those who are suffering from addictions as well. And so we'll be rolling out those over the course of the next little while, and we're hoping that will really help us. I don't want to see people, and I don't think Manitobans want to see people living in bus shelters. It's not right. And so we really need to have a two-pronged approach to that, a balanced approach, an approach that is helping those individuals, with a hand up to help them move out of that, but also looking at making sure our streets are safe for Manitoba families so that they are more likely to come downtown. We want them to be able to go to the Forks and to be able to walk around the Forks and not, fear that something may happen to them. And so we'll continue to move in that direction to make sure that, not only are we helping those most vulnerable on our streets, but we're also helping to make sure our streets are safer for Manitoba families.
Given all the turmoil in the healthcare system over the last few years, why should Manitobans trust your party to fix it?
Well, I think we've said first and foremost, we've put Manitoba patients first through our task force, our surgical and diagnostic task force, making sure that we are focused on getting people the surgical and diagnostic procedures that they need sooner. We recognize also that there's a human resources challenge. That's why we announced $200 million towards 2,000 more healthcare professionals working in the system in Manitoba. But we didn't, other provinces were able to increase the capacity within their provinces by contracting out with other services within the provinces in private clinics and so on. We didn't have the capacity here in Manitoba. So we're focusing on increasing that capacity. So rather than now when we're having to contract out those services with other provinces and some in the United States, we want to make sure we're keeping that here. But in the meantime, in the short term, the most important thing is that Manitobans are getting those surgeries that they need, and they're getting the diagnostic procedures that they need as soon as possible.
Are you saying you're putting patients first and your party is, and other parties will not?
So I'm saying, what I'm saying is that we are putting together, I think, a plan that is short, medium, long term to addressing the major challenges that are taking place. And we won't take an ideological approach when it comes to that. We will always put what is in the best interest of patients first to ensure that they get the health care that they need. We know Manitobans, everyone sort of has been visiting with people over the holidays. They've been hearing and listening to people who are suffering, waiting for a surgery or a surgical or diagnostic procedure. I want to make sure that we know who is waiting out there and how do we help them? How do we help their families? How do we help their loved ones, their neighbors, their friends get through that? And so those are some of the things that we are going to focus on.
A December poll shows your party's popularity continuing to lag. Why do you think that is?
I don't put a lot of credence in polls, I will say. I think we've just come through 2 successful by-elections where we have 2 incredible new MLAs that have joined our team. So excited to move forward on that. I will continue to focus on what needs to be focused on, which is what is in the best interest of Manitobans when it comes to growing our economy, when it comes to ensuring the healthcare services are there, when it comes to ensuring that our downtown is safe, that our communities are safe right across our province. These are the things that we will continue to focus on. I'm not going to focus on numbers that are meaningless, frankly.
But you are concerned about the public not knowing enough about what your government is doing. So that does give you concern.
Yeah, but I think that's just, I need to get that message out a little bit more to Manitobans. That's okay. That's a good thing, and I think we've got an incredible team of people, and I wouldn't say that's certainly not because of any polling or anything. It's just that, when we're out talking to Manitobans and we're saying to them, well, we've done this, we've done that, oh, we didn't know that. So I think we've just, because of being out in the community, because of hearing directly from people that they don't necessarily know. I mean, I think you're in communications, that if people haven't heard it 8 or 10 or 12 times, they don't necessarily, know about it. And so I think it's important for us to ensure that we're getting that message out to Manitobans.
Yeah. 11 of the MLAs you had a year ago are not running for re-election. You said a few days ago that this is a chance to rejuvenate your party and grow the tent. How do you do that? How do you recruit candidates that reflect Manitoba's community?
Well, I think we're already doing it. 2 by-elections. We've got Abhi Khan and Kevin Klein, 2 outstanding individuals in our communities and in our province, and so we've started that already. I also just want to say to each and every one of my colleagues, I know what it's like when you make a decision to get into politics. It's very much a family decision, and if you don't have your family around you wanting to, you need to have your family support, right? It's very important, and I think moving forward, those are a decision when you decide to get out of politics. Any decisions in politics at all, and any change, you are making those changes and those decisions based on discussions with your families. And so I think those individuals have done outstanding things. They've been very committed to their communities. They've been fantastic, in some cases, cabinet ministers, but MLAs. They've supported their communities, and I thank them for their service. I'm really excited, Ian, about some of the people that we have coming forward right now that are excited about getting involved in our party. So I think you'll see over the course of the next little while some contested nominations in some areas, and I think it's really exciting. As I said before, rejuvenation in a party is good, and I think it's great for us moving forward.
I know you've heard the critics who disagree with your government's opposition on supervised injection sites. Has any of that criticism caused you to reflect or even reconsider your position?
I think a lot of us, we all have the same end goal in mind, that we want to help individuals with a hand up to help them get to get through their addictions, right? And so I think, we are making those investments in naloxone and Narcan. We are making those investments in our rapid access to addictions medicine clinics. And you'll start to see, and those are sort of the, again, the 1,000 addictions seats spaces as well. That's going to be critical moving forward and making more investments in those areas. Again, all in the short, the medium, and the long term when this is coming around. But our focus will continue to be on getting people off of their addictions and getting them the recovery that they need.